Hello friends, and this lecture is on lasers, and lasers, as you know, is an acronym for light amplification by stimulated emission of radiation. Lasers have certain characteristics. That's all the waves that the lasers produce are in phase, both in time and space, and this is known as coherence. The waves are of one wavelength and one color, and this is called monochromaticity. And the waves can travel in parallel direction without being non-divergent, and this is called collimation. So you can actually send laser beams from the earth to any planet or even outside the galaxy. They will keep traveling. So what determines the type of laser? So one thing always is wavelength. Like I said, each one has got specific wavelength. The other thing is known as the power density. Power density is basically the energy delivered per unit area of cross section, which is measured in watt per centimeter square. So how powerful laser will be, that is dependent on the power density. So this light, like I said, laser's light is coherent, and this can be focused into very small spots where you can deliver very high energy, and this can be used to cut or vaporize tissue. Lower power lasers can be used for coagulation as well. You do not need as much energy for coagulation as for touching. So the laser actually consists of a tubing and a tube which is got lasing material in it, and based on this lasing material we actually call them lasers. So this could be a carbon dioxide laser. It could be a yttrium YAG laser. Okay, so gas, liquid, or solids it can be. The two sides of them have a reflective mirror, but one side of the mirror, on the one side it is partially transmitting mirror, so that's where the beam of light will come off. And then there is actually energy is pumped into this to the lasing media, and this energy can be in the form of electrical discharge. It can be as a flash tube, or it can be even another laser. Okay. So this is how it works. So you have a stable atom. You throw some energy on it as a form of photon, and this becomes an excited atom. So when it becomes excited atom, it moves to another level. Okay. And when it actually comes down to its resting position, it will release a photon. Okay. But if you actually now provide more energy in another photon, before this excited atom actually comes to its resting position, then it releases two photons which are of the same wavelength, and they actually are in phase, so they can actually travel long distances. Okay, so they are coherent. Okay, this is how the laser beams are produced. So if you look at lasers in the medicine, there are lasers which are in the visible range. So these are like krypton, argon, neodymium YAG laser, KTP lasers, helium neon lasers. Now these fall in the visible range. You can see that the wavelength of these are between around 400 to anywhere between 600 or to 700. So these are in the visible line, in the wavelength in nanometers. And because they fall in this visible range, they can be used to transmit via the optical fibers. And the wavelength also gives them a very specific color. So if you look at krypton, it is blue to red. Argon, it is blue-green. And neodymium YAG KTP lasers are green in color. Helium neon lasers are red in color. Okay. Then you have lasers which are in the infrared or near infrared light. Neodymium YAG laser has got a wavelength of 1064 nanometers. And this can be transmitted through optical fiber, but carbon dioxide, which has a wavelength of 10,600 nanometers, which falls in the far infrared range, this cannot be transmitted through optical fibers, so you need a series of actually mirrors to transmit the carbon dioxide laser. So some of these lasers, depending on the wavelength, can only, the larger the wavelength, the more superficial it is. So the lower the wavelength, the deeper it can penetrate. So if you look at carbon dioxide laser, it is absorbed by all tissues and water. So it can be used for general use for precise surgical cutting or coagulation. Neodymium YAG laser, YAG stands for yttrium aluminum garnet. These are solid ones. And these are absorbed by dark pigmented tissues. So this can be used for coagulation and tumor debulking. And if you combine the neodymium YAG with KTP, KTP stands for potassium tetanyl phosphate. This is absorbed blood. So again, it can be used for general use or for pigmented lesions, hemangiomas kind of thing. Argon is absorbed by melanin and hemoglobin, so these can be used for vascular tissues, and they also can be used for any pigmented lesions, excision of pigmented lesion. Krypton is absorbed by melanin, and it can be used for general use or for pigmented lesion again. The lasers are also depending on their power, classified 1 to 4. And the class 4 are very high powered, they're extremely dangerous, and they use energy up to almost 500 megawatt. This can vaporize the tissues very easily. And the lasers which use in for like the laser pointers, these are class 1 pointers. Okay, but they should still not be actually exposed to the eyes. You should not point them to at people. So what are the hazards associated with use of lasers in the theaters? Operation theaters. So a lot of surgeries, ophthalmic surgeries, ENT surgeries actually are done using lasers. They can also be used in general surgical theaters for debulking, or gynecological theaters for debulking tumors. Now, so the hazards can be to the environment, it can be to the patient, and it can be the people or the staff. So this is a classification for that. So if you look at the environmental thing, so we know that lasers are used for vaporizing, papillomas. They have, viruses. They're laden with viruses, and when they are evaporate, they produce something called plume. These plumes can be, inhaled by people around, and that's why atmospheric contamination. It can cause seeding of viruses in the staff. So it's not a good thing. They need to use proper filters for that. The patient and staff may also be exposed to fire and explosion. If this energy is not misdirected to, say, for example, a solution which is contain alcohol, that will likely catch fire, or even to tissues which are soaked in, say, cleaning solution, that can catch fire. The things like explosives conditions, they can be explosions as well if it is in a closed environment. So fire explosions are possible. In the patients, because the amount of heat that is generated by laser, it can actually boil the blood and cause embolization. Other is inappropriate energy transfer. If the light is actually strikes something which is very reflective, it can actually go anywhere. And obviously to hollow viscous, it can cause perforation as well in patients. So what do you do to prevent this hazard? So important thing is in the environmental factors. So I talked about the suction and filters, especially for tumors where there is vaporization and plume formation occurs. Then you need to have lasers in the sign in the rooms where used, or in the OR where used, and the doors and windows, they need to be completely shielded, except for the carbon dioxide, which cannot actually cross through clear glass. The rest of them can actually pass through anything. So doors and windows need to be closed all the time. Other thing about the staff, I will tell in the later on. The patients, and so under anesthesia, it's important to actually prevent fires and explosion. Oxygen is combustible, and nitrous oxide, supports combustion. So if you are giving GA, so make sure that the FI2 is never more than 25%. You use specific laser tubes. And all the equipment which is used during the use of laser should actually have matted surface. And best thing is to actually use a total intravenous anesthesia in these cases, so that you don't actually have to give a lot of oxygen or nitrous oxide or other stuff which support combustion. For the staff, it's important that they are actually trained in the use of lasers. That I don't mean the use of machine lasers, but they have the technological information about what lasers do, what harm the lasers can cause. And so they will not then allow other people to come in who have not had training. So training is important. Also, they need to wear specific kind of goggles, and that will likely bring us to the OSCE stations here. So first OSCE station is a tube. This is called a laser flex tube. You can actually see on that the size of this is 7 millimeters tube outer diameter, but the inner diameter is like a pediatric tube. That means that the metal which is on it is actually very thick. It is reducing the size internal diameter to 4.5. The other thing you'll notice that there are two cuffs and two balloons, and there is one blue and white. So one of them is proximal balloon, other is distal balloon. And some of these tubes actually have methylene blue crystals. So when you actually inject them with water, it will form blue color. And this is important when the energy falls on the cuff. It does two things. One thing is that the water will absorb this energy. So for short burst, because lasers are always in short burst, it will absorb the energy, so it will not cause any damage to the cuff as easily. But if it causes damage to the cuff, the surgeon will immediately see the blue. Okay, the surgeons are monochromatic like lasers. They see red, they see blue. So they can actually see blue, and they will know that the cuff has burst, and they can inform us. The second cuff will still protect the airway. There are tubes, ordinary tube people use, they wrap it around with a the aluminum foil or copper foil. And these are not the best ones to use because you can actually have areas which are not protected, and the tube actually can actually still cause combustion, and this can cause severe airway burns. So it's not a good idea. It's better to use specific laser tubes for them. Then there are actually laser tubes, which have cuffs instead of actually, using water or saline in them. They actually are made of sponge, and you can still use water. You can soak them in water, but you don't actually have to infiltrate. So there is no risk of them actually being ruptured, but they can still catch fire. So that's not the best thing. So the next OSCE is about the goggles. So the goggles are very, very important for protecting against the laser for the staff. The surgeon might be actually playing Star Wars and pointing the beam here and there, or it might actually get reflected from a surface which is not matted. So goggles are very, very specific. So you can see this is green tinted one. This is used for neodymium YAG laser. This looks a little bit red. This is for KTP neodymium YAG lasers. And then this is for the patient. So patient's eyes also need to be protected. The way patient's eyes can be protected is that either you can use, obviously, once you have shut them down as you would normally do, you can put some saline soaked gauze pieces over the eye and then tape it. Or you can also actually use shields, metal shields. You can use goggles like this as well. The next one is again a goggle which is orange in color. This is, you will see in the ophthalmic theater. This is the organ for use for organ. So this is orange color goggles used for organ or krypton. The other thing is I told about the carbon dioxide. Carbon dioxide actually can stop by ordinary glass. So you can use ordinary glasses, but not your contact lenses. They don't protect you against lasers, carbon dioxide laser. And also you need to actually have a wraparound protection in the goggles like these shown here. You can actually see that they should protect you. So the laser beam can come from any side. So you need to actually have wraparound protection for yourself, the goggles. So for carbon dioxide laser, it can be either a normal glass ones, goggles, or it can be plastic goggles are actually also fine for them. Since the carbon dioxide is actually not visible to naked eyes, and that's why the surgeon would not know where to point it. Usually it is combined with another laser. So carbon dioxide is always combined with another laser, and that's why sometimes you would actually see that you are actually wearing goggles for that particular laser, which is actually the indicator laser. So it could be a very low it need not be the laser, medical laser. It can be actually a low class laser just to help you, the surgeons, to point the beam of carbon dioxide. So with this, we end the lecture on the lasers, and thank you very much for listening to this lecture.